Before doing any lip filler, numbing is essential, especially if you're planning on doing it yourself. The stamina it takes to do your own lips really requires lidocaine. I know personally. Today I'm going to be breaking down how to do a lip ring block using 2% lidocaine without epinephrine.
You can tell me if I'm right or wrong.
You guys, I always get so nervous before doing something for the first time. And of course I'm filming it, so here we go. It's going to be good. It's going to be great. By the way, you can get this on Amazon. I have it linked below, okay? I'm probably going to have to do voiceover for this. Work, lip, work. There are some things that I learned in this and some takeaways. Okay, first, this video is for educational and informational purposes only. I am not providing medical advice, and the content is not a substitute for professional training. Always consult a licensed medical provider before attempting any injections or anesthetic procedures. If you love content like this and don't want to miss another video, hit that subscribe button so you're here every time I post. Leave me a comment below. I really do read them. And make sure to share this video to your Facebook page so more people can see what's possible at home. And if you want even more insight into doing professional skincare at home, join my private app, Natural Kaos. It's always linked here, you guys. That's of course where I can be more open, sharing advanced treatments, and where our large community posts daily routines and results. So my plan today is to show you where I'm going to place these injections, how much lidocaine I'm going to use, and my mapping for both upper and lower mucosa injections. Then I'm going to jump into my app, as you guys know I normally do, for the actual injections because I can't do those for you on YouTube. I'm sorry. But if you're interested, make sure to download the Natural Kaos app. That video with the injections will be there. And then on top of it, I'm going to time how long this lasts so that we know how long this lip ring will last for your comfort. So this week I decided to do some research into how to numb up your lips. Previously, I've done my lips a few times inside the Natural Kaos app. I typically use a cannula, and so I just numb on the ports where I would insert. But I've been in this Russian injection class over the last month, and their Russian technique for doing lips looks so painful, you guys. There's no way I could get through it without a full numbing of the lips. And I thought, okay, well, I'll just learn to do a dental block, which you can find online. But a dental block lasts for about 3 hours, and you don't really need 3 hours of numbing to be able to do your lips. So then I was flipping through my filler book, and I came across this idea for numbing up the lip ring. Then I verified it online and found other information on doing it. So this is what I've put together for myself. It's kind of a hybrid of everything that I've noticed and learned and seen online. I've never done this before, so I'm your guinea pig and we'll see how it goes. Here are the essential tools for doing the lip ring block. I have 2% lidocaine. I have 2 30-gauge half-inch needles. I have 2 syringes that are 2.5 mils. And then I have a topical 20% benzocaine with Q-tips that I'm going to use for 5 minutes before I do the injections. Let's look at my mouth. Here are the areas I'm going to inject. For the upper lip area, I will administer 5 injections spaced evenly between my canines. Each location will get 0.3 mils of 2% lidocaine. The most lateral injection, meaning the furthest one from the center of our face, will be above my canine, between it and the tooth that follows it. You will insert your needle toward your eye into the mucosa, the thin skin that attaches your lips to your teeth. So when we talk about the mucosa, we're talking about this area. And you're going to go up into it. So you know how the lip covers it. You're going to stick your needle up straight into it. Then I will move inward towards the second tooth and inject between it and the third tooth towards my nose. So here's 1, 2, and this is the third tooth. So we're going to go right between these two, straight up. And it's kind of in line with the edge of your nose. It basically is the edge of your nose right there. The center injection will be straight into the upper lip frenulum, the string of skin that attaches your lip to your teeth. Now, you guys, when I was little, I fell down and broke teeth and split that. So my frenulum is not attached. It's been detached, so you can't really see it in me. But basically, this is an injection that goes between the center of your teeth straight up towards the tip of your nose. Okay, so it's going to be right in here on the inside. So that means that the upper lips are going to be getting 1, 2, 3, 4, 5. 5 injections on the top. I know, you guys. I'm not looking forward to it. We'll see how this goes. All right, for the bottom area of our lips. So for the lower part of our lip, I'm going to do 4 injections. These will be equally spaced between the mandibular cuspid, or your 4th tooth. So this is your mandibular cuspid. We're going to go right between it and the tooth behind it. So right down there. For this injection, you will want to have the needle inserted parallel to your mandible. So this is our mandible. Right? So when we go in and do this mandibular cuspid, or your 4th tooth, we're going to be angling the needle in, but it's going to be going straight back in parallel with our mandible. So you're not going to be digging it down. It's going to be going in line. For the next 2 injections on your lower lip, it's going to be in the center area on the side of your lower lip frenulum. I don't even know if I can say that right. Frenulum. frenulum. I'll just put it up here. So for the bottom lip, we're going to be getting an injection here. 1, 2, 3, and 4. My understanding from research is that you don't have to go very deep in these areas. I'm planning on inserting my needle about 2 millimeters deep and then injecting the fluid into that area. This will be a total of 2.7 milliliters of 2% lidocaine, which is definitely within the range of safety for a woman my size. All right, you guys, we're at that time where it's time to start numbing the inside of my lips with the topical 20% benzocaine. I got this on Amazon and it's watermelon flavored, so we'll see if it tastes good. So I grabbed 9 Q-tips because I'm doing 9 injections. So we'll get a bunch. I don't know. I guess that looks like enough. I feel like when I go to the dentist, they do a lot, so we'll do a lot. I don't know how I'm gonna keep talking as I do this. So I don't know, maybe we'll do some music. Kind of spin it around. I think that's smart. This center one is gonna suck.
Yeah, I got a situation. You can tell me if I'm right or wrong. She's quite the sensation.
Okay, so there's our 5. Now I'm kind of wondering how I'm gonna do this for the lower part. I think what I'm gonna do is I'm gonna clip off the ends of these. That way we don't have the sticks. Now, how do I get it out? Okay. Oh, probably you should clip it after you dig it out. Probably wasn't very smart.
But the list goes on and on. Touching on the tattoos.
You know what a good technique would have been? Dry your mouth out before you do this. That way it's dry and you don't have any liquid that's kind of getting in the way of the numbing gel. But we're already here, so here we go.
While she does coke in the bathroom. While the band plays in the back room. Trying to take her out the venue. She's somebody that don't need nobody. She's just stuck in my head.
Okay. This is like pickup sticks in your mouth. Probably didn't understand what I said. Let's put on our gloves. Here's our 2% lidocaine. I marked on them where the 0.3 mils were, so it'd be easier for injecting. Then I marked one lower, and I marked one upper, so I knew. It's not the same amount for her. So for the upper, we're going to be drawing up 1.5 mils.
Body, she's just stuck in my head.
These are our 30 gauge 1.5 inch needles.
Well, it's a satisfaction, I can't get no reaction. She's just stuck in my head.
Okay, my mouth is feeling kind of numb, so I kind of feel like I want to do the injections.
She's somebody that don't need nobody. She's still stuck in my head. Lips of satisfaction, I can't get no reaction.
Okay, I have numbing gel like all over my mouth. I don't even care. I'm going to jump into my app now and I'm going to do these injections. I'll be back with you guys in a minute and let you know how it goes. All right, the topical is going to wear off, so we better get going. So here is my canine. I'm going to be going up into the mucosa, straight up towards my eye. I hope that I did a good job. I would say the one thing that is difficult is once you start to lose sensation is to know if you're in and it's hard to see. So you're going to have to be very careful, obviously, and just pay attention. Definitely the tips of my nose is already getting numb. I'm going to set a timer now and see how long this lasts for us, okay? All right, I'm back. I just stopped my timer, stopped at 35 minutes. And the reason I did was because I started pinching my lip and I could like pinch it and feel it. And I would say that it probably didn't really go full 35 minutes. There are some things that I learned in this and some takeaways. Okay, first, I'm not sure if I'll use the benzocaine to numb up first. And the reason is when you're doing your own injections, you need to be able to feel the placement, and the benzocaine works amazing. Like, it didn't hurt to do the injections, but it also made it hard for me to gauge the needle depth. And one thing that I noticed was that on this side, that's more numb than this side went away much faster. So I know I didn't hit this very well. This side, I know I got the needle up pretty high. And for a dental block, you do get it up pretty high because you have a nerve here. And so when they do the dental block, they're trying to numb up this major nerve. So I think that I got into that region better on this side. And that's the reason the numbing on my lip lasted longer. But because I couldn't really feel feel, because of the benzocaine, it made it difficult. I also know that on this side, I wasn't deep enough on the lower end because I couldn't feel. So I think when I do this next week in the app, my plan is to not use benzocaine and just take it, you guys, because injectable lidocaine burns. You will feel it. And even like sometimes when I got in past the mucosal layer and was like in the skin, I could feel the burn of the lidocaine. But as you start to inject, that area goes numb. So I think that you should just know that if you aren't going to use the benzocaine, there is going to be a burn. It's going to feel like a strong sensation, but it will immediately dissipate as you inject that lidocaine in and it starts to numb up the region. So I definitely think for these canine injections right here, it's good to be as deep as possible. So taking the hub all the way up on that 1/2 inch so that you get a longer, fuller numbing sensation. I'd also say that on the lower ones, you need to make sure that you're in the skin pretty deep as well. I did not feel like I numbed up my lower lip as well as I was able to numb up my upper lip. I'm also concerned that by not doing the dental block, the numbing does not last that long. So I'm thinking in the app when I do the lip injections, I might numb up my upper lip first and work on that and then numb the lower part and work down there, because if I numb up everything in the beginning, then the lower lip by the time I get there is not going to be as numb anymore and it's going to create a lot of uncomfortable sensations. Okay, we are not quitters. So I'm back today. I am going to try this again. I did more research. I had found this document online where this guy was doing 5 injections on the top using 0.5 milliliter of 2% lidocaine per injection. That seemed like a lot to me, which is why I scaled mine back, but it's still within the safety protocol for someone my weight. And then the lower area, he doesn't angle it back as my book said to do. He's just going straight down. And if you look at the anatomy of the mental nerve, it really is straight down below the canine. So I don't think you need to angle back. And really, I did not get my lower lip as numb as I wanted to. So today we are tackling this again. I'm upping the amount of lidocaine I'm using. I'm doing 0.5 milliliter, so 5 cc's of 2% lidocaine per injection. We're going to do the 9 placements again, 5 on the top, 4 on the bottom, but I'm going to be just going straight down in the bottom one. I'm going to go straight up, trying to make sure that I get close to that infraorbital nerve so that this whole area gets blocked out. I'm not going to be doing the topical numbing cream today because I want to make sure that I get my needle placement right. And since the numbing cream works so well, it's hard to tell. This is going to burn. I'll be back with you guys after I do this inside my app and I'll let you guys know and I'll time it again so that we get a better idea if I got fully numb and how long it's going to last. Awesome. Okay, we are numb. I'm going to set my timer. I'll let you guys know how long it goes for, okay? All right, I'm back. Let's stop it. Okay, we're at 34 minutes. Another lesson learned. I definitely got my top lip perfect. Definitely that worked great. Those placements worked great. The amount worked great. So it's going to last about 30 minutes because my lip is already coming back to life. It's all still kind of numb and cold, but definitely like I can feel it. I did not still get my lower lip numb. It got numb and I could have done the lip filler. It would have been okay. I got my chin super numb. Like this whole area was super numb and it's coming back now too. And then I saw this video on YouTube because that's where we get our education from. And what they were doing is on the lower lip, they are actually not injecting straight down where it meets, but they're injecting in this area. They're doing all their injections in this soft tissue area. My plan when I get ready to do this is I'm going to first numb up my upper lip and do the upper lip injections so that we know that that whole 35 minutes we're good. Then I'm going to numb up my lower lip and I'm going to do the injections along here, this whole area. So still staying in line with the canines, but all 4 injections are going to be more in the soft tissue area. And I think that's going to really make it numb and comfortable. So that's my plan. I hope that you guys join me inside the app to watch it. I know that this video is coming out after I've already done it, but you can go download the app and watch what I do. And then the full lip ring injection portion of this video is inside the app as well. So I hope that gives you guys insight. I'm still talking a little weird. That's our video for today. And I hope you guys have a great week. I am talking so weird. Bye guys. I want to do the side ones first because I think those will be the most difficult for me.